As pharmacists, we play a crucial role in ensuring optimal antibiotic efficacy and preventing drug resistance. One of the most clinically significant drug interactions involve fluoroquinolones and divalent or trivalent cations such as calcium, iron, magnesium, and aluminium. So mechanism of interaction: fluoroquinolones, for example ciprofloxacin, levofloxacin, and moxifloxacin, they form chelating complexes with calcium, iron, magnesium, and aluminium in the gastrointestinal tract, rendering the antibiotics insoluble and poorly absorbed. So what does this result to? It results in decreased bioavailability. You don't have enough antibiotics to be able to exert its action. You have reduced microbial activity and then treatment failure. And the consequences of this is that there will be increased risk of prolonged infection and bacterial resistance. So what is the clinical implication of this interaction? Number one, you have reduced efficacy. Ciprofloxacin absorption decreased by up to 85% with aluminium or magnesium containing antacid. Then for calcium and iron containing substance or supplements, they reduce fluoroquinolone area under the curve by 20 to 60%, leading to subtherapeutic plasma concentrations. It will also lead to treatment failure. Infections such as urinary tract infection, pneumonia, and prostatitis, they may persist or become worse, and this is especially dangerous in immunocompromised patients. There's also a risk of antimicrobial resistance. The subtherapeutic fluoroquinolone levels will promote bacterial resistance, and particularly in organisms such as Pseudomonas aeruginosa and the E. coli. So who are those people that are high risk? So here are some high risk scenarios. For instance, patients on supplements like calcium, iron, zinc, and multivitamins. We have elderly patients that are taking antacid, e.g. aluminum or magnesium hydroxide. Then we have patients that's osteoporosis patients that are on calcium supplements, and then anemic patients that are on iron supplements. So when you have patients like this, what do? Because they need to take these supplements. So as a pharmacist, this is how you can prevent this interaction. Timing is important. So administer fluoroquinolones at least 2 hours before or 4 to 6 hours after calcium, iron, magnesium, or aluminium containing products. So you tell the patient, this is when you should take this supplement and this is when you should take your antibiotics. Now, if a patient requires an iron supplement, you can consider switching the fluoroquinolone to a non-interacting antibiotics like ceftriaxone for urinary tract infection. So you also check over-the-counter use. You ask the patient, because most patients might not even know that the over-the-counter drug they bought might be interacting with this drug they have. So many patients may unknowingly take calcium or iron containing over-the-counter products like milk or multivitamins. So you educate them on avoiding dairy or supplements when you are dispensing the fluoroquinolones to them. Then you can go for alternative formulation. IV fluoroquinolones, they bypass the interaction and may be preferable in hospitable patients. That's patients that are hospitalized. So important notes: you have to stay informed to be able to deliver better health outcome. You have to know your onion in order to be able to effectively educate this patient on what to do when taking any particular drug. If you found this information helpful, don't forget to like, share, and subscribe for more. Thank you. See you in the next episode.